Hello, my name is Dr. Anshum Aneja Arora, and I'm a consultant chest physician at Arrow Health Gurgaon. I'll be discussing about coronavirus disease and its current involvement with special consideration and respect to respiratory system. We all know that lungs are the main affected organ in this disease, and protection of our lungs before catching the infection has a lot of significance. So we'll be discussing about how we can protect our lungs from catching this disorder and what special considerations are to be taken. Let's divide our discussion into two groups. One who do not have any known respiratory condition and the other group who have respiratory issues. So for people who are absolutely healthy, no respiratory problems, never been on regular medication, then social distancing, wearing the mask, hand hygiene, and all these measures which have been told to us time and again over the last few months are the sole and the most important criteria in protecting ourselves and our families. Do not ignore the importance of isolation. We as a unit, as a family, as a person, if we are able to maintain the social distancing beyond these days of lockdown, we will be further able to protect our family from this disease. For patients who have respiratory issues, for patients who are asthmatics, COPDs, who have ILDs, or any long standing lung disease, including tuberculosis, the first and the foremost thing to understand is that the disease or the presence of the risk of infection does not alter your everyday medication and the requirement of medication of your pre existing problem. Do not stop inhalers in the wake of being worried about taking something in the lung already. Do not stop your asthma medications, your allergy medications, if you know that they have been prescribed for regular use by a doctor. If there is any doubt in any medication, please contact your doctor and ensure that these medications are to be continued or discontinued. Do not take over the counter medications without asking your treating physician because these medications may have interactions with other medicines that you are taking and may affect your body's immune response. For patients who are on immunosuppressants or steroids, like patients with steroid dependent asthmas, patients with lung parenchymal disorders, make sure that the dose of steroid that you're taking should be in consultation with your doctor. Patients on immunosuppressants should try and wear masks at all times, even if at home, because you will be able to protect yourself from aerosol-borne infections. Remember, you are at higher risk of infection, especially the viral infections, because your immunity is already on a weakened state. For all of us, whether having a pre-existing issue or not, remember that the disease can vary from mild to severe. There is a spectrum. Not everybody will have the severest form of disease. However, the patients with high risk, like elderly people, very young people, or children who are infants, patients with diabetes, patients with blood pressure, heart failure, kidney problems, and lung problems, as I mentioned, they are the ones who are at higher risk. And these patients have to be cautious about symptoms like new onset breathlessness because it can herald the onset of respiratory failure requiring ICU support. Most of us will have mild to moderate disease at some point of time if we are exposed. And for that, simple home remedies and just staying at home can help. Patients should also be careful with general measures. If you perform few simple measures at home, you can actually increase your lung reserve. Exercising is one of them. Exercising has an important role to play at this point of time because if we can increase our lungs capacity, if we can open up our passages, keep them decongested, remove all the phlegm and the mucus that we have in our nasal passage and throat, then we can protect ourselves from respiratory complications. Make sure you're taking a lot of hot liquids. It is hypothesized that mucus impaction is one of the cause of morbidity in a lot of patients who have been diagnosed with severe coronavirus infection. So, hot liquids can help you protect yourself from phlegm deposition. It can protect you from other flu like illnesses. So, make sure you're doing it regularly. Also, wear masks. Wearing masks should now become a norm. We all should try and wear masks when outdoors, unless we have got this disease wavered off. Wearing masks comes with its own significance and special precautions. Never touch a mask from the outside. If you touch a mask on the outside, you are actually taking the infection in your hands, and that way you can further have an infection and spread it to others. Always remove the mask from the back. Whether it's a string from the back of the ear or whether you've tied it at the back, never touch it on the front and remove it like this. Wear clean masks. You need not wear surgical masks at all times. Surgical masks are meant to be worn by healthcare professionals. So if you do not have a surgical mask, that should not preclude wearing of a mask. Wear a cloth mask. Cover your nose and mouth adequately. Stay home, stay safe. If you have any flu-like symptom, dry cough, fever, sore throat, body ache, report to a doctor. Do not try and self-treat yourself. Maintain social distancing and maintain hygiene now and beyond. Together, we can fight this disease. The medical profession has been able to find a cure for most of the diseases in the past, and we will be finding a cure for this too. The time is only crucial. So stay home and be protected.